Doctor, I've heard that both aerobic exercise and strength training are recommended for diabetes, but I'm not sure which one I should prioritize. Should I focus more on walking or jogging, or should I mainly go to the gym and do weight training?
That's a common question. To answer simply, aerobic exercise and strength training or resistance training serve different purposes, so ideally, you should do both. But depending on your fitness level and physical condition, it's perfectly fine to start with just one.
I see. So how exactly does aerobic exercise help lower blood sugar?
With aerobic exercise, blood flow to the muscles increases during activity, which opens up more of what we call blood-4 channels. These are like doors that allow glucose into the muscle cells. This happens even if insulin isn't working well, so your muscles can absorb glucose directly. That's why taking a walk after a meal can help prevent blood sugar spikes.
So walking after meals is especially effective. But does the effect only last right after exercise?
The immediate effect is said to last for 24 to 48 hours. So while daily exercise is ideal, even every other day can help with blood sugar control. And over time, consistent aerobic activity boosts your basal metabolism, which means you burn more energy even at rest.
That's impressive. What about strength training? What are the benefits there?
The main benefit of strength training is that it increases muscle mass, which improves your body's ability to store and use glucose. Your lower body muscles make up about 70% of your total muscle mass, so exercises like squats and lunges can significantly improve insulin resistance. In fact, regular resistance training 2 to 3 times a week has been shown to reduce HbA1c and fasting blood sugar levels.
I see. So each type has its own advantages. But if I had to choose, which one is more effective at improving blood sugar?
Most research shows that combining both is the most effective. People who did both aerobic and strength training saw greater reductions in HbA1c than those who did only one. In short, they work synergistically when done together.
I figured that might be the case. But with work and everything, I don't have a lot of time. How should I combine them realistically?
Ideally, you could aim for aerobic exercise 3 to 5 times a week, and strength training 2 to 3 times a week. For example, you could walk or jog for 30 minutes on Monday, Wednesday, and Friday, and do bodyweight exercises like squats or chair sits on Tuesday and Thursday, 10 to 15 reps for 2 sets. If you're short on time, you can try what's called the exercise snack approach, where you do brief strength exercises for about 10 minutes after meals.
Exercise snack, that's a fun term. Can short sessions like that really help lower blood sugar?
They can. One study showed that doing light resistance band exercises for just 10 minutes after meals reduced blood sugar spikes by more than 20%. Since the intensity is low, you can easily fit them in during household chores or work breaks.
That sounds manageable. Are there any precautions I should take before exercising? Like, should I avoid it if my blood sugar is too high?
Yes, there are a few important points to keep in mind. If your fasting blood sugar is over 250 mg per deciliter, or if you test positive for ketones, it's best to hold off on exercise. Also, if you have advanced retinopathy or serious kidney problems, exercising too intensely can be risky. So always consult your doctor and start with a safe, moderate plan.
Got it. I'll start with walking as my base, and add strength training twice a week. I've always avoided strength training, but this might be a good time to give it a try.
I think that's a great idea. You'll likely notice improvements not only in your blood sugar, but also in your energy and mood. Let's keep working on this together.